Hi, my name is Maureen. I'm going to be doing my head to toe assessment. Today is March 25th, 2021, and this is my patient. I'm here to do your head to toe assessment. My name is Maureen and I'm your nurse today. Right now I'm just going to go wash my hands first.
Okay.
Okay,
Yes. Okay.
there we go. Okay. I'm going to wet our hands a little. Get some soap. And you wash your hands for about 15 seconds. And you sing happy birthday twice and get in between your fingers and up to your wrist a little bit. And scrub your fingernails on your, get any dirt out that might be there. Or the top. I'll take one. And just pat your hands. And the other one. We'll pat this one. And then you take a clean one and you turn off the faucet. And now we're off to do our head to toe assessment. Great. Okay. Hi, I'm Maureen the nurse and I'm here to do your head to toe assessment. Could I have your name and date of birth?
Yes, Nancy Jordan, November 11th, 1947.
Okay, could I just see your arm bracelet? Great, it matches up. Are you having any pain today?
Yes, I am.
And where is it located?
My back.
Does anything make it better or worse?
Well, I do a lot of house cleaning, and when I do that, after it begins to hurt. So
And do you take something?
I do. I take Tylenol.
And on a scale of 1 to 10, 10 being the worst, how would you say your pain is?
Probably a 7.
Okay, and it relieves by taking Tylenol.
It does. Yes.
Great.
Yes.
Do you know where you are today?
I do. I'm at the doctor's office.
And the current president
The current president is Joe Biden.
and the season?
The season is spring.
I forget the other one, but that's okay. So first, I'm going to have you blow your cheeks out, smile, frown, anyways. So now I'm going to inspect your head.
Okay.
I'm going to put some gloves on. Okay, I'm just going to inspect her scalp for any lesions or rashes or cracks. Okay, we'll do the other side. Great. Scalp looks clear. I'm going to take my gloves off and use some hand sanitizer. And now I'm going to inspect her ears on the pinna. I'm going to check for any lesions, any sores. They're nice and clear. And now I'm going to inspect the ear canal by pulling the pinna back and out. Turn your head. And her ear canal is clear, no redness or drainage. Oops. And I'm going to do the same for the other side. No redness or drainage. And now I'm going to, I see you wear glasses. Do you wear them all the time?
I do.
Okay. I'm going to have you take those off.
Okay.
And I'm going to have you pull down your conjunctiva. Her conjunctiva is pink and moist. Okay, you can release. And then her sclera is white. Her iris is blue. And now I'm going to inspect her pupil for Perla. And her pupils are round and reactive to light. And now I'm going to have you follow this just with your eyes. And I'm going to go in. And her eyes are accommodating. Great. Now I'm going to assess her lymph nodes. There's no swelling in her lymph nodes. Her trachea is in the right position. Can I have you swallow? And her thyroid is present.
That was very good, Lipton.
And now I'm going to actually inspect your mouth. I'm going to have you open your mouth and stick out your tongue. Her teeth are white, no cracks. Her tongue is clear. Can you move it side to side? And the other side? And her tongue is pink and moist, and her gums are pink and moist. Next, I'm going to have you put your arms out, and I'm going to have you push up, and I'm going to have you turn and push down for strength. Her strength is strong, and I'm going to have you squeeze my hands, and her strength is strong. Okay, very good. Now I'm going to actually have you put your arms out again. Oh, I don't have a fucking watch. I don't have a watch, but I'm going to make like I do. We're going to take her radial pulse bilaterally for 1 minute. And her pulse is 74, which is normal because it should be between 60 and 100 beats per minute. And now I'm going to check your fingers for capillary refill on 10 fingers and any clubbing. Very good. And then your thumbs, please. Capillary refill is less than 3, which is normal. Okay, I put my stethoscope. Okay, now I'm going to listen to her lungs posteriorly. Okay. First, I'm going to, you can just sit forward a little bit.
Yep.
I'm going to actually palpate your back. If you feel any pain, let me know. Can you turn the other way? Can you turn this way? Yeah. Okay. I'm going to palpate her. If you feel any pain, let me know.
Mhm.
And this way. This way. This way. This way. No pain?
No pain.
Okay. And if you stay like that, I'm going to just listen to your lungs.
Mhm.
And you don't want to go over any bony prominence because you will not hear anything. So I'm going to start. I'm going to have you take a couple deep breaths. Very good. Her lung sounds are clear posteriorly, no crackles or wheezes or stridor. And now I'm going to assess her anterior. You can sit back. Okay, I'm going to do the same thing and palpate the front. If you feel any pain, let me know. Great. Go under. No. Okay.
No pain.
Great.
No pain.
Now I'm going to listen to your lungs again, and we're going to take a couple of deep breaths.
Okay.
Again, don't go on over any bony prominences. You won't hear anything. And one more. Anteriorly, her lungs are clear. There's no crackles, wheezes, or stridor. Great. And now I'm going to have you lay back a little because I'm going to check your jugular vein distension.
Okay.
You're going to go this way?
Yep.
You can even use that if you want. That's
Yeah.
fine, both of them. Okay.
I don't think you can see it.
Okay. Come up on the pillow a little more, this one.
Okay.
Okay, so we're going to do this? Yep. That's great. You can just lay back a little on 40. I'm going to have you turn your neck to one side. We're checking for JVD. Okay, and turn your head the other way. And we're checking for JVD, and there's no JVD present. Okay, and now I'm going to check your bowel sounds. Yep. Looking at her stomach, inspecting it, there's no distension. I'm actually going to listen and then palpate. And if you have 5 to 30 clicks, it's normal bowel sounds. If you have 5 to less, it's hypo. And if you have less than 5, you have no bowel sounds. You have to listen to the bowels, your bowels for 5 minutes straight. And normally you should listen to it for at least a minute. Okay, here we go. She had 27 clicks, which is normal bowel sounds. And now I'm going to listen to the other quadrants. And then we go to the right upper quadrant. And the left upper quadrant. And the left lower quadrant. She has active bowel sounds. Now I'm just going to palpate. If you feel any pain, let me know when I'm pressing. No pain?
No.
No pain?
No.
No pain?
No.
No pain.
No.
Great. Okay, now we're going to go check her feet. I'm just going to turn this down a little bit. It's okay. Okay, great. So now I'm going to have you Can I take your sandals off?
Yeah.
Okay. I'm going to have you push against my feet like you're driving a car. Her strength is good. I'm going to check her dorsopedialis pulses on top. And they are present. And I'm going to check her posterior tibial. And those pulses are present and strong. Now I'm going to check her capillary refill and on her 10 toes. 1. Oh, we don't have any more toes. Capillary refill is less than 3. And now I'm going to check her, actually I'm going to have you lift your leg up and the other one. Very good. Her range of motion is good. I'm going to actually check her, oh Jesus, her capillary, her edema, see if she has any fluid retention with her nice friggin' legs. And you press down, and if there's pitting of 1, it's 2 centimeters. 2 plus is 4 centimeters. 3 plus is 6 centimeters. And you go all the way up to the knee. And you do it on the other side as well. There is no capillary refill. There is no edema present. Okay. I just wanted to ask you, when was your last bowel movement?
This morning.
And what color was it?
Brown?
You having any diarrhea or constipation?
No. No, I'm not.
And with urinating, is there any burning, odor,
No.
incontinence?
No.
Okay, great. And now I'm going to have you stand up. You're just going to walk like right here. I'm going to have you walk forward.
Okay.
Very good. And walk backwards.
I'll walk backwards.
Backwards. Very good. Her gait is stable. And do you have any questions for me? You feel okay?
I do. I feel fine. Thank you.
Wonderful. And that's the end of my physical assessment. Thank you.